Hello, everyone, and welcome. In this session, we'll begin our discussion on adult sepsis screening and treatment protocol. Sepsis is one of the most important medical emergencies that every nurse should be able to recognize and manage promptly. Early identification and timely intervention can save a patient's life. Throughout this lecture, we'll understand what sepsis is, who is at risk, the common causes, and the early warning signs that every nurse should identify during patient assessment. Let's get started. First, let's understand the meaning of sepsis. Sepsis is a life-threatening condition that occurs when the body's response to an infection becomes uncontrolled. Instead of fighting only the infection, the immune system starts damaging the body's own tissues and organs. This can rapidly lead to tissue damage, organ failure, and even death if it is not recognized and treated early. One important point to remember is that early recognition saves lives. The sooner sepsis is identified, the better the patient's chance of recovery. Now let's look at septic shock. Septic shock is a severe form of sepsis. In septic shock, the patient develops serious circulatory and metabolic problems. Blood pressure falls significantly, blood flow to organs decreases, and the risk of death becomes much higher. This is considered a medical emergency and requires immediate treatment. Not everyone has the same risk of developing sepsis. Some patients are more vulnerable than others. These include older adults, especially those over 65 years of age, babies younger than 1 year, patients with weakened immune systems, and people living with chronic diseases such as diabetes. These patients should always be monitored carefully whenever infection is suspected. A useful way to remember the high-risk groups is the mnemonic BFF-CHILDS. B stands for babies under 1 year, F stands for frail or elderly patients. The second F stands for fighting weak, meaning people with low immunity. C stands for patients receiving chemotherapy or radiotherapy. H stands for patients who recently had surgery or a serious illness. I stands for people taking immune suppressing medicines such as steroids. L stands for liver, lung, heart, or kidney disease. D stands for women during or after pregnancy. Finally, S stands for infections caused by antibiotic-resistant organisms, also known as superbugs. This mnemonic is very useful during clinical practice. Let's now discuss abdominal or tummy infections. Sometimes a patient may complain of severe abdominal pain. Important warning signs include unexplained abdominal pain, swelling or bloating, pain that becomes worse when the abdomen is pressed. In some patients, especially with genital tract infections, there may be foul-smelling discharge. These symptoms should never be ignored because abdominal infections can progress rapidly to sepsis. Next, let's discuss the common microorganisms responsible for sepsis. Some of the most common bacteria include Staphylococcus aureus, Escherichia coli, commonly called E. coli, and certain types of Streptococcus. Knowing these organisms helps us understand the possible source of infection and guides appropriate antimicrobial treatment. Where do these infections usually begin? The most common source is the lungs, causing respiratory infections such as pneumonia. The second common source is the urinary tract, especially urinary tract infections. Other common sites include the abdomen, the gut, and the skin, particularly infected wounds or cellulitis. Whenever you assess a patient with suspected sepsis, always try to identify the possible source of infection. Many different infections can develop into sepsis if they are not treated promptly. These include respiratory and chest infections, abdominal infections such as appendicitis, peritonitis, cholecystitis, and cholangitis, urinary and genital tract infections, skin and wound infections, neurological infections such as meningitis and encephalitis, and severe infections involving bones, the heart, or the bloodstream. Every nurse should consider these possible infection sites during assessment. Now let's look at the early signs of infection. A patient may develop a temperature above 38 degrees Celsius or below 36 degrees Celsius, severe uncontrollable shivering, feeling unusually tired, loss of appetite, muscle and joint pain, vomiting, and diarrhea. If these symptoms are present, the patient should receive prompt medical assessment because early treatment helps prevent progression to sepsis. As sepsis becomes more severe, more serious symptoms appear. Adults may become confused or develop slurred speech. They may experience difficulty breathing. Their lips may become blue. Hands and feet may feel cold and clammy. Urine output decreases. Patients often complain of severe muscle or leg pain, and some develop a non-blanching rash. Children may become unusually sleepy, difficult to wake, breathe rapidly, stop feeding, or produce fewer wet nappies. Whenever these symptoms are present, urgent medical attention is required. To help recognize sepsis quickly, remember two useful mnemonics. The first is sepsis, slurred speech or confusion, extreme shivering or fever, passing no urine, severe breathlessness. It feels like you are going to die, and skin mottled or discolored. Another helpful mnemonic is Keldy, BERRYS. This reminds us to look for confusion, oxygen problems, blue lips, dizziness, breathing difficulty, extreme pain, rash, reduced urination, yellow or pale skin, and patients who remain unwell after 24 hours. These memory aids are useful during both examinations and clinical practice. Recognizing sepsis early is one of the most important responsibilities of every nurse because early intervention can save lives. If you enjoyed this video, don't forget to subscribe and hit the bell icon for more nursing updates. Want to learn more about sepsis? Join Xfini Academy today. Our contact details are in the description. Thank you for watching, and we'll see you in the next video. Happy learning.